Hi, I'm Seneca Williams, and welcome to this brief virtual consultation. In this consultation, I'm going to be talking a little bit about who I am, a little about my practice, and answer some of the questions that you might want to have in a consultation. I'm a licensed mental health counselor, certified professional coach, certified journal writing facilitator, and a speaker. And I usually work with professionals and entrepreneurs who are trying to build mental health for their life, work, and their business. What brings you to therapy now? You might have answered that question when you scheduled your consultation so that I can know a little bit about you and what you need. It's important to think about how you're really doing. A lot of professionals experience stressors at home, work, or both, which leads to anxiety, depression, chronic stress, grief, all kinds of things. And if we're often in autopilot, we're not thinking about what we really feel and what we really need support with. Are you having difficulty most days? What are some of the challenges that you've been having? Is it hard to manage the current situation that you're in? Have you been noticing some patterns going on in your life or your work and your business? If this is your first time in therapy, welcome. If not, you can fast forward. Finding a therapist for the first time can be really overwhelming, but you took the first step and you're here, and I'm glad. I usually work with adults who are between the ages of 25 to 65, so they're on their professional journey. They may be at different places on their professional journey, but they're all working. And at some point, they're looking to improve their performance, they're looking to improve their mental health, they're looking to improve their relationships, or they're experiencing some kind of high functioning anxiety, high functioning depression, or maybe a life transition like moving or wanting to move or wanting to change jobs or something like that. I'm licensed in New York and Florida. So if you're in one of those two states, then you're all set. And you are the person that's responsible for paying for your own health care, meaning you don't have to depend on somebody else to pay it for you. You're the one responsible for either your insurance or self pay. These are just some of the past issues that I've worked with clients. So I created some lists here. Some of the issues that we usually address are like adjustment disorder, anxiety disorder, social anxiety, depression. And you'll see like a list of other things there. You can like screenshot this or pause it here just to see what are some of the things that I've worked on with either professionals or with entrepreneurs. If you've been in therapy before, if you are changing therapists, these are some things that are important to think about. Why the change? Are you changing because you've recently moved? I know how hard it is when you move and you have to lose your therapist because they're not licensed where you used to be anymore. So that can be really challenging. Sometimes it's not about like moving, sometimes it's schedules. So my schedule is Monday through Friday, no weekends, no holidays. My first session of the day starts at 10 a.m. My last session of the day is usually in the late afternoon, like around 3 p.m. You should definitely feel comfortable to talk about everything. And I mean that. I have all kinds of clients, all kinds of demographics, and this is the safe space to talk about every and anything at all. Also, it is important to understand your therapist specialization. So, if you're looking for marriage counseling, couples therapy, your primary concern is relationship issues, I wouldn't be the right fit for you. I would be the right fit for you if you want to focus on improving yourself, self esteem, confidence, your performance at work, your performance in your business, interpersonal relationships, productivity, confidence, overcoming maybe how your anxiety and depression is affecting the way that you work, or preventing burnout. Those are some things that I would say I specialize in. So, why is therapy important for building your career or business? It's because we spend most of our times working. Our whole life, it seems like we spend working. So the average person will spend 90,000 hours at work over a lifetime. I know, right? That's a lot of work. You want to think about, are you happy in your career or your business? Are you happy in your job? And I don't mean like happy, like thrilled every day, but you don't want to have the Sunday scaries, or you don't want to dread going on vacation because you have to go back to that job. You shouldn't feel that way. That is a sign that something's not right. How is your work impacting your mental health? If you are coming home and crying at night, if you feel sick in the morning before you have to start working and you don't want to get out of bed, those are some things to think about. Let's talk about how I can help you improve your life, work, and your business through therapy. Therapy is all about learning ways to cope with the current situations that you have. So you may not be able to change the situation, but maybe you can change what you think, feel, and do in the situation. I use cognitive behavioral therapy. You might have heard of the term CBT. Cognitive behavioral therapy focuses on your cognitions, the types of thoughts that you have, and your behaviors. It's all about what you think, feel, and do. I also believe in being very solution focused, and sometimes I encourage journal writing as a way to track your process and your progress. We start off with one or two sessions where I'll be doing a full assessment to get to know you and a little bit about how you operate, how you function, how you came to be, getting your history about therapy, mental health, life, and work. And a treatment plan is something that we'll come up with collaboratively about what it is that your therapy goals are. So if you think about in the next 12 weeks from now, where would I like to be? What are some things I'd like to focus on 12 sessions from now? We'll come up with some long term goals, and then we'll come up with some short term goals. Okay. The short term goals are how you're going to get to the long term goals. Are you using insurance? If you are, great. The best way to know how much your fees are going to be is by inputting your information into one of the billers that I use. So you might be using either Alma, Rula, or Headway. They accept the major insurances, and they'll do an insurance verification so you'll know what your responsibility is. If you don't know for sure through one of these platforms, you can always contact your insurance provider to confirm what your insurance payment should be. If you're doing self pay for therapy, like paying out of pocket without insurance, that's okay too. You can use a credit or debit card, and you'll share your information in one of those platforms, those third party biller platforms. You will also select auto pay, which makes it so that you can set it and forget it. So after your session is done, you'll be automatically charged right after the session, so it doesn't have to get all awkward. Let's see. Did I answer most of your questions? What is your specialization? What state are you licensed in? How do you see clients? Well, as you may have seen, 100% online. What are your hours of service? I shared with you 10 to 3 p.m. Can you explain how your treatment modalities can help me? We answered that. Do you provide homework? Oh, actually, I forgot to mention that. I might provide a worksheet or an article or recommend a book if I think it is aligned with what we talked about in session, or it's aligned with your therapy goals. How do you accept payment? We talked about that. What's the attendance policy? So if you're running late or you miss a session, there are cancellation fees. So it's best to reach out 24 hours ahead of time so you do not incur any fees. Have you received specialized training? Cultural competency? Yes. Also, as I said, I have certifications in journal writing and in life coaching. What if you need medication? I can definitely refer you to a licensed psychiatrist where they can have an assessment with you. If you are ready to get started and you want to skip the process of actually going through, let's talk about what I do and how I do it and all this stuff, you can just bypass the actual session and let me know that you want to get started, and I'll add you to my list, and then we'll get started. And once we schedule you for your first session, all you have to do is use the link that you get to come on to your session. Make sure you're in a quiet place. You're not driving. It is private, quiet, private, and safe. If someone is in that space with you, if someone's in the car with you, if you're driving, we'll have to unfortunately reschedule. All right, I think that's about it for now. If you have any issues, any questions, or concerns, you can email me at support@senecawilliams.com. I look forward to seeing you soon. And if you want to connect with me on any social media, feel free to do so at AskCoachSen.